Hi, my name's Sean. This is 342 video for female catheterization. Today we're going to be catheterizing an individual with female anatomy. We've been to the bedside, we've assessed their abdomen and looking for distension. We've done a PVR, we know they are retaining urine. We have looked at the urinary opening, the urethral meatus, looked at skin integrity, and discussed hip mobility. They have consented to the procedure. We've looked at the we looked at their chart for allergies, especially silicone and whatever it'll come to me. We've looked at their chart for allergies. We've also looked at the medical history for history of trauma, urinary strictures. They don't have a prostate. We've looked at the chart for the doctor's orders, rationale for catheterization. We're going to the type of catheter. We're going to use the smallest catheter possible, as well as the need for CNS or RNM. We have also looked for potential complications. We'll continue our assessment for pain, urinary blockage, retention, abdominal distension, pain, if I didn't say, and catheter-associated UTI. We have prepared our materials, we have cleaned our table, and we are ready to go to the bedside. I'm going to knock to ensure privacy as I approach. I'm looking to do a PCR. Looking for safety. I come in. Hello, my name's Sean. I'm a nursing student. I'm going to close the blinds behind me for privacy. Can you tell me your first and last name? Just going to look at your wrist here. Good, and your date of birth. Great. We've done 2 identifiers. Do you have any allergies? Great, awesome. So again, my name's Sean, I'm a nursing student, and just like we discussed before, I'm gonna do your catheterization today. Before I tell you anything about it, can you tell me what you know about catheters? Yeah, that's right. So it is a soft tube, and it goes into your urethra, which is the hole you pee from, and it sits all the way up into your bladder. It's got a little soft balloon that's filled with saline that allows it to sort of sit there, and it's got little holes on the end that allow the urine that's staying in your bladder to drain out. Now, the reason we're giving this is because you are retaining urine, which can cause some problems inside your bladder and up towards your kidney. So it is a risk versus reward thing, and we do want to get that urine out, okay? It's not forever, it's just for as long as needed. There are some risks associated, including infection, like urinary tract infections, but we're gonna mitigate that by having a second person. I'm gonna bring Grady into the room with me, and he's gonna hold the light, he's gonna help remove the blankets. He's also gonna provide a second set of eyes to make sure that I maintain sterility. And science has shown, or research has shown, that that's decreased the effects of infection. So if you're good to go, we can start now. I'll start preparing my material. I'm just gonna bring your bed up to a workable height for me. I also just wanted to mention that I understand this is a really vulnerable time and a really vulnerable procedure. So if at any point you want us to stop, you just let me know and we can take a break. I also understand that we're 2 men, and if you'd be more comfortable with someone else providing this care for you, we can certainly swap out providers. So you just let me know what's best for you, and you feel like you can take a break or ask us to stop if you're triggered or uncomfortable in any way, okay? Okay, so if you're good to go, let's get it done. Are you comfortable like this? Okay, it's gonna take about 10 minutes. You're gonna lay on your back with your hips slightly flexed and your knees open. Are you able to tolerate that? Good, no pain in your hips at all? Okay, and if you're not, for whatever reason, my partner Grady here can help you with it, all right? Okay, so I'm just going to, just do some hand hygiene again. We did some when we came in the room, but let's just do this now. Let that dry, clean my thumbs and my wrists. Okay, so this is the bag. This doesn't go in you, but I'm just gonna secure it to the side of the bed here. Good, and I'm just gonna bring this underneath your leg right now, okay? So we'll just leave that right in there. That's at a nice working height for me. And I'm going to put on my PPE. So in addition to this gown, I will be wearing a face shield, but for the ease of the video, I'm not going to wear the face shield today. Okay. I am wearing it. I could also have my partner help me with this, make it a little bit easier. Okay. So my tray is clean. I'm going to start opening up my equipment. I've got garbage here. All right. So, hand hygiene. You doing okay there? Good. Okay. So, open away from myself. These should not be here. They should be on the lower end. Open away from myself. Open away from myself. Lift this up. This is where these would be. I can turn it. Good. So now I'm just gonna bring my garbage can here. I'm just gonna set this up. I'm just gonna put this right between your ankles. That's just gonna be my garbage can. Okay, and we're gonna take this out here. This will keep in. We'll take one of these out. Okay, that can come down there. I'm gonna open up our saline, not reach over our field. And saline onto our gauze. Good. We have 2 pieces of gauze in there, but just in case, I'm gonna add a third. Okay, at this point in time, I can also open my catheter. The catheter's got a good integrity. It's not expired. And really carefully put that in there. Okay. So I've got PPE on. I've got my bag ready. I've got my Foley and the kit. At this point, I can also open up this and just open that into my tray. Okay, so at this point in time, I'm ready to put my sterile gloves on. My partner's good to go with the pen light. Pat, you still doing okay? Good stuff. So I'm just gonna put my gloves on here. And hygiene. Good. And I'm gonna come over and just put those in the bag. Hand hygiene again if we need to. I'm gonna open up my sterile gloves. My garbage. This curtain will be here behind me. Okay. So. 1, 2, okay, so now put that on the ground. Okay, so all good to go. I'm gonna have my partner pull the blankets down now. Pat, we're just gonna pull the blankets down just as far as we need to expose you. We're gonna bring the gown up just above, right there. Good. And now if you could just spread your hips open, bend your knees a little bit. My partner here can support you to do that as well. My palms down here. Good. And I'm just going to open my catheter bag now here and remove my catheter. As we pull it out, we're gonna wrap it around our hand. Okay. This can go in my garbage, and then good. It's got a good integrity. Okay, I can open up my lubricant. Good, into the garbage, and I can put the tip right in there. Okay. So we are going to open up our flap here. And I'm just going to lay this drape over top of you. Good. You still doing okay? Awesome. Okay. And then this can stay here. We're going to bring this in. So reach in. Good stuff. Okay. Doing all right, Pat? Okay. So I'm going to just clean you now. I'm going to take my tweezers. I'm just going to contaminate this hand. So I'm going to stabilize and access the meatus with this hand. Good. I'm going to take one cloth. Just going to get some of the moisture off that. Next time I will wring these out before I do it. I could put this down and just wring it out, but I can get enough moisture. Okay, so we're just gonna down the outside. That goes in the garbage. Good. Down the outside into the garbage. I brought this third one here. And then right down the middle here. Okay, to clean. Good, that can go in the garbage. Now my tweezers can go in the garbage and this cup as well. All right, so just get the extra. Okay, so Pat, if you're doing all right here, I'm just gonna get my partner to remove this catheter or the lubricant. Okay, and Pat, I'll get you to take nice full breaths in and out. My partner is going to shine the light now. You're still doing okay. We're going to insert the catheter. So when you're ready to get nice breath and on your way out, good. Insert the catheter. Insert, 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 insert. We start to get urine there. Okay, so it's leaking urine. Good, 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 good. I'm just going to insert it a little bit more and stabilize that. It's leaking urine. Good, so now it's stopped leaking urine. In real life, if there were lubricant on the edge, I would take a cloth and wipe that off. I may consider getting a new catheter altogether. But at this point, I'm gonna insert the balloon. Good, just putting saline into the balloon there. Well done. Okay, and now I can let go and tug this out a little bit. Good, I find the neck and let that hang in there, and I'm just gonna insert it a little bit more. Okay, so I would use the urine that's in this tin now to get a sample for CNS or R&M if I need it. I can otherwise break sterility because I no longer need to be sterile. So I can come and just reach in here. I'll have my partner remove the cap there. Being careful not to contaminate the end, and connect that there. Okay, still doing okay? Right on. So we are almost done. I'm just gonna clean up, okay? And so at this point, this tin is empty and is secured to the bed. So I am going to take off my sterile gloves. I'm gonna chuck those in the garbage. I'm gonna do hand hygiene. Good. And then I've got gloves here. My gown would be up probably around my neck. It would be drifting down like this. At this point in time, I can tear my drape. Okay. Being careful not to pull on the catheter. We can take this out. That can go in my garbage. Okay. And if my hands are still clean, then I can come over here. This is my skin prep swab. It didn't open well. Might get a new one, but that's fine. I'm gonna see the bag is on this side, so I'm gonna prepare this side. Would you like to get out of bed on this side? Yeah, that's best for you? Okay, so I'll prep this leg. I wanna give it enough that, flip it over, 15 seconds, your cross hatch. Just enough that enough slack that for ambulation, but not enough that it's moving and causing irritation. Okay, so we'll let that dry. Once it's dry, you can come in and we can close this. That looks a good placement. Okay, that's good there. Open. This comes underneath their leg. And so this is, for this patient, this is too much slack. Oops.
So now I'm going
Oops.
to
Just gonna struggle with it for a minute here. There we go. And we'll get that close. So I would bump this down just a little bit. This is just a little more slack than I would like. We'd have more feel with another person. So we can cover you up here. Are you still doing okay? How are your hips? Okay. Didn't ask if you wanted anything for pain or anxiety, but I could have done that. We're just gonna bring this down. We notice that it is draining into the bag. You're warm enough? Good. I can get rid of these before I start touching your gown, actually. Do hand hygiene. Now I pull the gown up, pull this up, and can lower you down to the floor. Okay, just some education pieces while I tidy up here. I think we can come off. So this is a catheter that's attached to a Foley bag. Because your urine is draining into this bag, if you're moving around, I want you to keep the bag below the level of your bladder, because if that urine comes back up the tube and into your bladder, it could cause infection. If you notice any pain, fever, feeling chilled, I want you to let us know, okay? Or if anything's just not feeling normal for you, just let us know. You've got your call bell right here, good and handy, okay? We're gonna put the rails up. We wouldn't put all rails up. Good. And make sure that there's no dependent loops. Okay? So at this point in time, we can close up our field, grab our garbage, do hand hygiene again, and if you need anything, you just call. Okay, I'm gonna go document the power chart and the PPR as well as the care plan. I'm gonna include the size of catheter, the time, the date, the number or the volume of fluid put into the balloon, the volume of urine drained throughout the catheter, and how well the patient tolerated the procedure. Thanks for watching my video.